Good. All right. So I thought that was really nice to hear about the program or the mission and the way it's laid out and all the different components of it. We are moving in the next two sessions to dig a little bit more into issues of program evaluation, program learning, as well as data use and data for decisions. So Divya Nair, who's in the back there. So Divya will be really digging into issues of data use, and data for decisions. And I think that fits very nicely with the conversation that we had earlier about what's happening with ICDS CAS and these kind of big data mechanisms. But before that, in my session today, I just want to touch upon issues that relate to program evaluation. So I will not be talking about monitoring, because monitoring is very different from evaluation. So I'll really only be talking about evaluation and asking and trying to sort of leave you with sort of some key concepts that I hope will stay with you a little bit as you start to think about how do we assess what works, and how do we also understand why something works or doesn't work, right? So I'll talk about both impact evaluations and process evaluations. So firstly, I think everybody should worry a lot about understanding, does what we are doing work, right? And these are some reasons that we should worry about this. Large amounts of money go into health, nutrition, and social transfer programs. I mean, today, as Subrat mentioned this morning, 9,000 crores is the budget for the National Nutrition Mission. But that budget is on top of already existing big spend budgets, both for ICDS and for health, right? So if you really look at it collectively, there's billions of dollars actually being spent every year, thousands of crores of rupees, maybe it's even more than that potentially. And so you kind of, it's worthwhile to ask, what return on investment are you getting when you spend that kind of money? And not just is there an impact or not, but are there better ways to do things even within these budgeted programs that actually deliver more impact? How much more would you need to do if you want to get even more than you're getting currently, right? So these are some big questions and big reasons to ask. And these are not questions that we need to ask because we're researchers or because we're policymakers. These are actually questions that we should be asking from a basic human well-being perspective. Because if at the end of the day, the programs and the money that is being spent on programs is being put out there, it's really to achieve impact for our client populations, right? And if you're doing things and spending money, and that spending of money and doing of things is not delivering impact for client populations, is not delivering good for the public, that to me is probably the most important reason to worry about evaluation and to worry about impact, right? So the kinds of questions that you can ask in impact evaluations are, did a program or an intervention have an impact relative to its goals? That's just a yes/no question. You can ask how much impact was achieved. So, did you get 1 percentage point decline in stunting, or did you get 7 percentage point decline in stunting? Did you change complementary feeding for 50%, or did you change it for 40%, right? A very important question we ask in impact evaluation is, was the impact that was achieved, was the change that happened because of the program that we implemented? So that is something that we call attribution, all right? Do you want to say that what happened on the ground is because of what you did? If you really want to say that, you need to think about design elements of your impact evaluation. We can also ask a lot of process questions. How questions when we do evaluations. We can ask, how was the impact achieved? What was the pathway to change? Why was more impact not achieved? How can I do this again? Can I get enough information on how this impact was achieved? That tells me what I need to do in another place to either replicate or adapt the program. You can ask questions about cost. How much did what I did actually cost? It isn't just the money that you put into your budgets. Any program has a range of different costs that also relate to the cost of client populations using the programs, all kinds of other things, right? Was there cost effectiveness? If you know that a program had impact and you spent a certain amount of money on it, was that actually cost effective relative to something else you could have done with that same money, right? You can do smaller program evaluations or implementation studies as well to say, did a particular innovation that I put in lead to specific outcomes? So one example of that, ICDS CAS that you heard about this morning, is it's not a program, right? It's a technological innovation in a large-scale program. So we are working together with colleagues from about 6 different institutions, evaluating the impact of that technological innovation. So we are evaluating ICDS CAS in 2 states, in Madhya Pradesh and Bihar, and trying to answer pretty much all of these questions. So we're looking at impact, we're looking at how, we're looking at cost. 2020, we have the results now, and we are putting them together to share widely. The other very important thing to remember in program evaluation, before and after is not the same as with and without, all right? And this is sort of a mini quote in a sense that really comes from a lot of discussion that has been happening around the Nobel Prize in Economics. How many people here in the room know who won the Nobel Prize in Economics this year? Okay, great, fantastic. All right, so the Nobel Prize in Economics went to people who really scaled up. They didn't invent the use of it, but they scaled up the use of randomized controlled trials in the world of development. There had been, at least a few big-ticket RCTs in development before that, but they really scaled this way of thinking. And this is one of the key messages from there, right? Before and after is not the same as with and without. Why? Yes?
What do you exactly mean by before and after cost?
Absolutely. I'll give you the ICDS CAS example, all right? So one of the things we're trying to do and look at in ICDS CAS is, does it have an impact on home visiting frequency, or age-appropriate home visiting, right? So we have a couple of, you could just look at it in, we have 3 districts in each of the states. We did a baseline in 2017. We did our end line in 2019. Okay, what happened in between this period in India? You heard about it, right? Poshan Abhiyan, huge amount of energy to the programs. Home visits are something ICDS is supposed to do anyway. So probably a lot of different changes happen in the same time frame. How can I say, if I just measure before and after, that the change that happened is because of CAS, right? So I have to really think about what else is happening, and how can I say that a certain change that happened is because of that particular innovation that went in, right? We have to remember that things change tremendously over time, right? We have to remember that, just as you start implementing a program, maybe another NGO has started implementing the same program in the same areas, and yet other things are happening in the national ecosystem. So therefore, before and after is never the same as with and without. So one of the big things we worry about in impact evaluation, so I will talk separately about impact evaluation and process evaluation. And the two are very connected and should be connected when people do program evaluations. But one of the big things you worry about in impact evaluation is this idea of causality and attribution, right? Can we say with some level of confidence that the program that we implemented caused the impact that happened, right? And many people don't ask this question. You just run a program, and you maybe realize about halfway through the program that, we should have an evaluation. Let me tell you, it's really hard to establish causality or to set up an evaluation or to say you had an impact if you haven't started thinking very, very, very early in your program design phases as to whether you want to answer this question. So if you want to answer this question with some degree of confidence that the program that I'm implementing or designing is going to have an impact that is because of this program, then you need to think about causality. So firstly, we should think about causality because we should not assume that our interventions will absolutely have the impact in the time frame that we have available for those programs to have an impact. I thought Ray Martorell's example yesterday about the child development, the null results in the early part, which they then saw child development results, later on at age 7 and, in the teenage years. was a really good example of that. You didn't see it in that time frame, but you saw it in another time frame, right? But we shouldn't assume that our interventions will have an impact at all. I mean, I think anyone should go into both a program and an evaluation with some degree of skepticism. Why? All of you have been doing some causal maps here, right? Right? And so for any problem that you're trying to change, you realize that there are many different risk factors. So the big question is we shouldn't assume we have impact because the program that you implement may not address the risk factor that actually causes the problem that you are concerned about. Right? The program is the only hammer you have sometimes. But is that hammer going to hit the right notes? Is that what the problem is, or do you need something else? The other is, of course, other things are happening in that ecosystem, and that's what we just talked about. So anyone evaluating the impact of programs, in a very busy ecosystem around, say, nutrition today, has to really account for the fact of, how is Poshan Abhiyan playing out in my districts where I'm doing an evaluation study, and is what I'm doing, going to sort of add value to that. The other thing, of course, is that the pathways to change are really long, and I'll speak a little bit about pathways when we get to the process evaluation. But if you've done risk factor mapping, you've also realized as part of that the pathway to change is long. So in relation to the causality things, there are two. The thing to worry about is really the with and without, okay? And the with and without, you'll hear the words counterfactual. How many people in the room have heard the word counterfactual okay, good, in the context of evaluation? So you have a program running, right? You know if impact is because of that program if you can also document what would have happened in the absence of that program. And that what would have happened in the absence of what I do is your counterfactual, right? So you have Poshan Abhiyan running, you have CAS running, you have something else running. What is happening, how can you say that the impact of those is, what is it that would give you a good counterfactual to those things running? And the challenge with creating a good counterfactual or a comparison group is what people doing impact evaluation worry a lot about, because there is a lot of bias in deciding where to implement programs. There can be a lot of bias in who uses your programs, and it's very challenging from an impact evaluation perspective to address that bias. Now, what happens often is that bias, not addressing these issues of bias, how programs are allocated to people or to communities, can actually be problematic for program evaluation, right? So what happens sometimes is you start a program and you start it in the worst off districts, okay? You can do an evaluation of that, so you can choose a bunch of other districts that you didn't do your program in, but by having decided to do your program in the worst off districts, those other districts are already better off than your districts, right? So if you measure impact without having considered the bias of placement, of placing your program in the most needy districts, you're actually hampering your chances to say that you had an impact. So if this is why the randomized control trials came up, because in a sense what they did was eliminate this placement bias. So what you would do, for example, is if you had 10 equally needy districts, instead of starting already in the worst off, maybe you say, okay, you know what, I'm going to start randomly, and I'm doing a little bit of a better job of eliminating this bias. The other bias that comes up is self-selection bias. And actually this happens a lot when you try to evaluate the impact of something like the ICDS. Now the ICDS is a program which in any community is universally offered, right? It's there and anyone can use it. If in that community, so everyone can use it, but in fact everyone doesn't use it. There is a huge bias in who uses the ICDS and who doesn't. Guess what? The wealthy people don't use the ICDS. It's often the poorer people who are worse off who end up using the ICDS, and they use it as a safety net. So what happens in some villages is if you go into the village and you say, hey, I'm going to compare the children of those who use the ICDS with the children of those who don't use the ICDS, you will invariably find, and we find this when we analyze the national data, the kids who use the ICDS are worse off, are more stunted than kids who don't use the ICDS. Why? It's a self-selection bias because of something in the mindset of people that this is a program possibly for poor people or this is a program for malnourished people. So they self-select and they come to that, right? So these are the kinds of biases of where programs are placed and of who uses programs that when you want to establish the causality or the impact, you really need to worry about. If there is one paper that I would recommend to anyone working in health on sort of connecting the dots between what you want to say about your programs and what kinds of evaluation designs you may need, it is this paper by Habik, Victor, and Vaughan from 1999, and we can make it available to you. But one of the most important things they put out there in terms of evaluation is you need to know what you're going to do with the results of your evaluation before you even start your evaluation, right? So, like I said, if your intent, if what you want to say is that that impact that happened is causally because of my program, that requires design, and it requires a way of thinking about designing impact evaluation that actually answers that question. And that is what we call an inference. You know, what is the inference you want to make from your evaluation? So they lay out 3 levels of inference that you may want to make. The first level of inference is simply about were the targets for the program achieved in the anticipated time frame. You're not asking whether change was because of the program. You're just saying, did things move the way they should have moved? All right? And this is where you can use, tracking surveys. This is where the before and after is just fine because you're not actually trying to say that the impact of whatever happened there is because of your program. You're just trying to say, did things move? Did we reach coverage? Did we, help to change? Did practices change? Not did we help to change practices, but did practices change? And often this kind of work is done in very large national programs and things like that, where in fact you're not asking any more questions of did the program cause the change? You're asking questions of are things on track? So if your big questions are things on track, then you will end up doing what's called an adequacy evaluation. Now, if you want to say that were the achieved targets plausibly, at least reasonably, because of the implemented interventions, you move into something called a plausibility inference. And there you need to start to think about some kind of a comparison group, ideally some kind of a before-after, enough additional data to make the links between what you did and what kinds of impacts you saw, okay? And then the last is what we call the probability design, and this relates to the questions I asked before, where you want to say with some degree of statistical significance and other levels of rigor that the achieved impacts were definitely, almost definitely, attributable to the implemented interventions, all right? So when you come to wanting to answer that question, this is where you really need to think very, very, very hard about the counterfactual. This is where you're much better off starting to say, listen, can I do a randomized evaluation here? Because that's your, it is still considered a best practice model for impact evaluation to answer the question of attribution. If you're not interested in asking the question of attribution, use any model you want, okay? But if you are interested in answering the questions of attribution, it's useful to ask yourself. And then I say this to all the implementers we work with, the day you start designing your program is the day you bring your evaluation partners on board. You do not bring your evaluation partners 3 years into implementation and then say, hey, help us talk about the impact of this program. Because if you do that, there's just too much bias in the system already because you've decided where to implement, you've done other things, you haven't thought about evaluation from day 0. So if there is one message you take away from this session, it is please think about evaluation from day 0, from your design phase, all right? Okay. So impact evaluation methods that focus on establishing causality are, as I mentioned earlier, randomized controlled designs, where you allocate the intervention randomly by lottery. This usually leads to the lowest risk of both, of allocation bias. Now the challenge with that, and we should discuss that because there are a lot of pros and cons here. You can only randomize what is actually possible to randomize, right? You can't randomize things that are sometimes too complex, too difficult. Often whatever can be randomized can be, as I call it, can be put in a box, okay? And I'll show you some examples of things that have been randomized and tested effectively in nutrition in a bit. You can do quasi-experimental studies where you have, as I mentioned, intervention areas and participants are compared with non-participants. There is still a very strong potential for allocation and selection bias in quasi-experimental studies. Because usually with a quasi-experimental study, because you have decided where to work beforehand, you're working extra hard to find comparable control areas or whatever else. So you've already introduced some bias by having allocated the geographies for interventions or target participants. On the other hand, it may be more real life. It may be more politically feasible. Like with ICDS-CAS, despite the fact that it wasn't rolling out, the evaluation conversations happened after the state governments had decided where to implement ICDS-CAS. And it was really sad because, in fact, they were only implementing in about 8 districts. And the rollout was slow. So if we had really planned it way in advance, we could have done a randomized rollout. So we had to work extra hard to find the counterfactual, and it will lead to some problems, okay? All right, I'm gonna skip the last part. There are other methods of finding matching which are more econometric, using large data sets and things like that. But those are often post hoc, right? So sometimes when large programs like, for example, large programs like Poshan Abhiyan run, many of us are already thinking about how can we use NFHS 5 and NFHS 6 to start to say something about the impact of, what's rolling. I mean, there's no allocation kind of things there. We'll just use participation data as reported by people from the surveys, and have to do some modeling work, econometric work to eliminate and remove all these biases. There are many examples of randomized controlled trials in nutrition. Yesterday, you had the privilege of hearing about what was, I think, one of the first sort of that type of randomized controlled trial, although I think some of the work on the vitamins goes way back, right, Ari? In nutrition, are you aware? Way back, even before the 1900s, I think the scurvy experiment. 1750. And that was the scurvy. It was a scurvy trial, all right? Is there anything that you see in the kinds of things on which there have been randomized trials in nutrition? Vitamin A supplements, zinc supplements, something that was done. So was it lemons in the scurvy experiment? It must have been, right? Not synthetic.
They didn't know anything about vitamin C.
Yeah.
They tried vinegar, salt water, lemon juice, and there's some other fruit.
Right. Is there anything that strikes out here that strikes you all? Sorry? Cash transfers, yeah.
Again, that can have multiple sort of pathways to impact any of these, right?
Absolutely, yeah.
Not direct sort of intervention.
Yeah.
Always targeted at something in multiple pathways.
We'll get to pathways. But this is a key feature of many randomized controlled trials, right? You can often put your intervention in some kind of a box that you can actually randomly allocate. For example, you can give some children a vitamin A supplement and not give other children a vitamin A supplement. You can give some groups a behavior change counseling using some models and other groups won't. What happens when you have complex programs? They become much, much harder to evaluate using these kinds of models. It's not like they haven't been done. So in a country like India with 640 districts, if we had randomized the rollout of Poshan Abhiyan, for example, maybe we would have had a model to say, with some certainty, a little more certainty, that these are the kinds of impacts that it was causing. Today, because that hasn't been a randomized allocation, but it has been a rolling allocation, we are going to find ways, I think, people will find ways to evaluate it in different ways. This has been a big criticism of randomized controlled trials. Economists who work on macro issues have certainly criticized the economists who won the Nobel for doing this, that you are only able to randomize what you can randomize. You can't change sort of big system level issues through necessarily randomization. But there are, those are all valid perspectives. they're still very useful tools to test the things that you can test using these models. But in the end, when you come to this question of what kind of evaluation design or impact evaluation design should I employ, when you work on programs and when you work on policy, to me, the most important thing that must drive the choice of an impact evaluation design is what is the question that needs to be answered, and what will anyone do with the results of an impact evaluation, okay? What you do with the results of an impact evaluation are to shut down a program. If you say, listen, I want to test this, and if it's not going to work, we are not going to do it again, that's a very different decision from saying, we're going to do this program is there anyway, so what we're doing is testing whether what we are doing can be improved. There have been many situations where impact evaluations have shown things didn't work and people shut those programs down. For example, wheat ration shops in Pakistan were evaluated, shown not to work, and they shut them down. Other things, our colleagues have worked on some things in Bangladesh, again, similarly, didn't work, shut it down, try something new, right? But more often than not, in sort of large-scale government settings, we're often never shutting down programs. NGOs, on the other hand, can have that luxury in a sense of saying, okay, I'm going to try something. If it doesn't work, I'm not going to do it again. But in public policy, many governments can never do that because they've already made big commitments to do certain things. And the only questions that they can really ask or answer are, how much impact is this program giving me right now? And then start to test other things maybe that can help to make that program better, right? But the use of the evaluation, the context in which it's being done, the opportunities to establish rigor. As I mentioned earlier, you cannot always randomize. You sometimes cannot even find a counterfactual of any kind because everything is happening everywhere. Those affect what kind of evaluation design you can have. The number one takeaway on evaluations for anyone in this room who might ever commission an evaluation is start on day zero. That's all. If you decide you're doing something new, if you want to say something about that a few years from now, bring in evaluation partners, bring in research partners from day zero. It's the worst feeling when somebody has done what sounds like a really amazing program and they call you in year 5 to say, hey, can you evaluate our program? And you kind of go, that's really tough. We can always try, but it's just not going to be as convincing a story, right? So these are findings from impact evaluations that I and my team ran for about 6 years. So this is the graph that came out at the end of 6 years of evaluation from 3 different countries. And I want to show you the value of the counterfactual, in a sense, by showing you this. So we were evaluating the impact of behavior change counseling, so similar things that are happening in Poshan Abhiyan and all of that now. Behavior change counseling by frontline workers in 3 different countries. The blue is Ethiopia. Sorry, you can't see that there. The green is Vietnam, and the orange is Bangladesh. So it was the same intervention. It was delivered in very different ways in the 3 different countries. So in Bangladesh, it was delivered by frontline workers who went home to home, like the Anganwadi workers, etc., do, counsel the mothers. And then they had these big community events and, religious leaders. So the kinds of things that are happening in Jan Andolan, for example, in India today, are very much influenced by the work of Alive and Thrive. In Vietnam, they deliver the counseling in health facilities. So a mother had to bring her child to the health facility to get it. In Ethiopia, it was implemented through government health workers, okay? And this is just showing the impacts in the 3 different places on one behavior. All of them promoted exclusive breastfeeding. They were all at very different starting points. So in Vietnam, so the dotted lines are the control groups, by the way. In 2 countries, we were able to do randomized control trials, all right? And we were able to allocate 10 sub-geographies, so the equivalent of blocks, to the intervention, and we had 10 others that were control. And the program was implementing at scale, so they just kept implementing in hundreds and hundreds of other blocks. But in a subset of the blocks, we ran this randomized evaluation of the program as it ran at scale. In Ethiopia, because of the partnerships that were set up there, because of the relationships with the government, the fact that they just wanted implementation to happen everywhere, there was no way to find a control. So in Ethiopia, we had what we call the adequacy design just before, after. And in the other 2 countries, we had randomized controlled designs, all right? So they all started at very different places. And what we were able to see very nicely in Bangladesh and in Vietnam is that these solid bars, which are the intervention groups, so this is data over 4 years, that and in year 4, there was much higher prevalence of exclusive breastfeeding in the places that had gotten the interventions. Now, what's really interesting in Ethiopia is it was very high to start with. It did go up a little bit, but we have no way of knowing what else was happening in the country and, whether even that small impact was in any way due to what this program had done. A very interesting evaluation episode that happened to us after we finished this Ethiopia study is that because the overall program realized that the results in Bangladesh and Vietnam were so much more convincing because we had the control areas, we then ran a second randomized control evaluation in Ethiopia to help them see whether what they were doing was having an impact. And what we found there, because then they brought in agriculture workers and health workers, is we found not only did they have an impact on behaviors, they also had an impact on stunting. Now, the results we saw in complementary feeding, again, the same study, we also looked at complementary feeding, were really quite different. So here, I don't know what happened to the green, but here, this is Ethiopia on the bottom, and this is Vietnam, and this is Bangladesh. So what happened in Vietnam is complementary feeding was already very high. It went up by 15 percentage points. If we had done just a before-after, we would have been like, oh, it went up, great. But what did we get by doing the with and without? We saw that it went up in the group that didn't have the intervention either, right? In Bangladesh, we found impact on, on both these sets of practices. And in Ethiopia, which has huge food security problems and other such things, we found a doubling actually of dietary diversity, even though it's still very low at end line. But we couldn't say anything about whether it was because of the program. In the second RCT that we did in Ethiopia, where we had the control areas as well, we were able to see not only did they have an impact on dietary diversity, but they also had an impact on stunting, funnily enough. We did not see an impact on stunting in Bangladesh. Despite these tremendous improvements in infant and young child feeding, we did not see impacts on stunting in Bangladesh. And part of our interpretation is that, in fact, behavior change was not enough. In the same time frame, there were 4 or 5 other RCTs running that used the same model of behavior change. One included a cash transfer. Another one included a food transfer. All of them found impact on stunting, whereas the behavior change alone did not find an impact on stunting. And what we found from the qualitative work is that, in fact, it was challenging for families to adopt all of the behaviors because they were resource constrained. All right? Okay. We also did a study on sustainability. So what happened in Bangladesh is we finished the impact evaluation. It was all very intensive. BRAC really scaled the program up because they got more funding because the evaluation showed it was so powerful. And so they then implemented in not 50 or 100 upazillas, but in 400 upazillas. And then we went back 2 years later to the same areas that we had done the impact evaluation in to see what were the impacts like. What we found was that there were still differences between the treatment and control groups, but those differences had lessened a little bit. And when we dug a little bit more, we found it's because they had made several changes to the program model because they now had less money. So they reduced supervision, they reduced incentives, they reduced monitoring, and the effects were a little bit less. They didn't have the same mass media campaign to accompany it. And so there were some very interesting lessons there on that you can achieve these impacts, you can sustain it, but if you change the model too much, you don't see the same kind of sustained impact. How are we doing on time? All right. Okay, I want to talk about process evaluation after this, and then maybe we can, come and take some questions, all right? So now, in all of these evaluations that we have been doing at IFPRI in particular, one of the big criticisms of randomized control trials is that they're a black box. You put something in and you look at impacts of things that come on the other side. The other criticism is, of course, that they answer yes/no questions or they answer how much questions, but they don't answer how or why questions, right? And so the reason we do process evaluations, and in fact, I have to say, in many of our evaluations, because they're often very long range, if you're studying anything on the 1,000 days, you have to give it 1,000 days to have an impact, right? And so many evaluations that look at child growth take many years to do. And so we spend a lot of time in the middle to actually do process evaluations. Really trying to answer questions about the theory of change. Did the program actually hit all the right notes? How did things work on certain things? How did things not work? How did people engage with the programs? And so usually process evaluations, they're very powerful when they're linked to impact evaluations. They should be linked to the theory of the program. What is the pathway of impact that you expect from what you do? They can help answer very critical questions about implementation or evaluation. And, and to me, what's kind of fun about process evaluations is they give you a much bigger methodological basket than a quantitative impact evaluation. You can do a range of different types of research that together answer a range of very important questions about how programs work. So this is, why we like to do process evaluations, because it's often such a big black box. So right now you have a lot of things that we are talking about doing in Poshan Abhiyan, and we're hoping that that delivers these 2 percentage point declines, right? But this is a long pathway from what happens there, from a mother coming to an Anganwadi center, receiving some counseling, to then, going back home and having to do what she needs to do. It's a long pathway. It's even a long pathway for you to make sure that the counseling that happens in that Anganwadi center for every woman is of quality. So the theories of change are really important for programs to recognize. I know Divya will talk about theory of change as well. And the theory of change really is that what happens in that black box of programs is affected by so many things inside it, right? It's affected by the characteristics of the implementation organization, of the people who use the programs, of the people who deliver the programs, of the context in which people live. So, I can give you information, but whether you can act on that information depends on your context. Whether you can act on it for how many feeding episodes did we estimate for complementary feeding, right? 5 times a day, I don't know, what is it, 1,000? 4,500 including breastfeeding. But if you say 5 a day for complementary feeding from 6 to 24 months, that's still a lot of episodes. Are you going to be able to do the right thing every single time? More likely than not, no. So there's a lot of contextual issues, right? So one of the things we do as evaluators is we help people map theory of change and what their expectations are. This is an example of one element of the theory of change of Alive and Thrive, of their counseling interventions. We really walk through this whole theory of change all the way from training to what should happen to health workers if they're trained, what should they then do, what happens if the counseling is effective. It's a long theory of change, and implementers need to really value and sort of appreciate how complex the theories of change are, because actually it sets your expectations in the right place if you have the right theory of change. Then what we did here was, in the first 2 years of the evaluation, we only focused on this part of the theory of change. We did not even look at IYCF practices or stunting or anything else until year 3, year 4 of the program, because we had to make sure and work with the program team to do the research that helps them see that the program is actually moving along the theory of change. So this is one part of the theory of change of ICDS-CAS, which we did as part of our ICDS-CAS evaluation. It is a really complex program, a really complex thing to roll out into it. And one of the things we did on this theory of change is we added the time element. So for example, it took 3 months for MWCD to get all the training manuals done and provide them to the state. It then takes about a month within the state for the state to actually print and photocopy and get all the manuals ready to go to people. The procurement of phones, so here the blue is all the device procurement and setup, the guidelines for phone procurement, the vendors for phone procurement, then getting the SIMs, Dimagi creating login details. It takes them a month to do that in any one state or one district, right? So the theory of change, even for something that feels as simple as a phone going into a big system, is very long. We started the ICDS-CAS evaluation, saying, should we even look at household behaviors? Once we learned about the program and the program's theory of change, we changed The outcomes, because we had a 2-year time frame to do the evaluation, and we are only now looking at service delivery. That is the primary outcome we will look at is, does the ICDS CAS improve visits in the homes by the frontline workers? Because we realize that actually looking at behavior change and then looking at other outcomes, it's just too far out in the theory of change, right? The other aspect that you need to think about in theory of change, especially when looking at nutrition outcomes, is that every nutritional outcome has a different biologic temporality, okay? We heard about the 1,000 days for child growth, right? I cannot implement a program today that reaches a pregnant woman today and expect to see the impacts on that woman's child now. I have to wait. So what's going to happen when we come to 2022 for Poshan Abhiyan, right? We're going to do maybe one of the NFHS surveys or something. So children who are 2 years old in 2022 will be probably fully exposed to Poshan Abhiyan, right? So they will be born. So children born in 2020 are likely the first cohort fully exposed to all the Poshan Abhiyan interventions in those states and districts where everything is rolling already, okay? But the children who are 3 years old in 2022 will have been exposed probably to some of the prenatal interventions. Children who are born, who are 5 years old in 2022, by the time they are out of their 1,000-day window, they have not been exposed to any of Poshan Abhiyan interventions, okay? So if I want to evaluate the impact of Poshan Abhiyan interventions in 2022, considering the biology and linking that to the temporality of the program rollout, I would do best to stick to looking at the impact in children who are 2 to 3 years old in 2022. I should accept that there will be dilution of potential impact when I bring in the kids over 5, because the biology of growth means that the children who are 5 years old haven't been exposed in the right time periods. And I think, again, that came out very nicely in Ray's lecture yesterday, right? Now, just coming back to our example from Bangladesh, why did we see the different impacts that we saw? I mean, you saw how the graph looked, you know, it had all 3 countries and the control groups and all in there, but the levels that they reached were really very different. And we were, because we had, you know, strong emphasis on understanding the processes and the context, we're able to interpret those results in context by having done a lot of process work to say that, you know, what we got in Bangladesh was probably the best we're ever going to get, because it was, well, the best on implementation reach, because they were working with a large-scale NGO program. They had a national mass media campaign. We were able to show that close to 90% of people were reached by the program, whereas about 70% of people were reached by the mass media campaign. What happened in Vietnam? It was done in a health facility. What does that mean? Somebody has to come to that health facility to access the intervention, right? And our data showed that, okay? So 45% of the population in those areas was exposed to the counseling because they had to come to get the counseling. And in Ethiopia, the outreach was through government health workers. You know, they just didn't have the bandwidth. They were doing too many other things, and so the reach was again a little bit lower. We also found that household context mattered a lot. So as I mentioned, in Bangladesh, we got to an average of about 40-something% impacts on dietary diversity. What we found, and we're still doing some of this analysis, is why were 100% of families not able to achieve dietary diversity, right? Because money matters. Socioeconomic status matters. And so in Bangladesh, for example, we found that if families were in a high SES household and had received the intervention, they were at least 20 percentage points more like they had, you know, the impact difference was about 20 percentage points compared to those in the poorer families. We found in Vietnam that the impacts of breastfeeding counseling were greater if women didn't have to return to work in the first 6 months after work. We found that the impacts on early breastfeeding were much greater when women had not had C-section surgeries, for example, for delivery. So understanding that context really matters in terms of actual impact is important, and as evaluators or the evaluators that you work with should get enough data on the context that helps us interpret. The other thing we found in the Bangladesh work was that the programs are introducing new concepts to families, right? On infant feeding and things like that. But in fact, people have been feeding babies for centuries. This is why the human race exists. So new information will always intersect with traditional norms. And what we were certainly finding in Bangladesh was this nice mix. We were finding that there was a lot of uptake of the new messages, but there was still a lot of traditional norms of how people did things in those communities, and some were okay and some were not necessarily not so okay. But we were able to show that the intervention was powerful enough to integrate the new messages into the social norms, and we used some ethnographic methods, so not quantitative methods, but ethnographic methods to sort of engage with this. Now let's talk about sort of implementation research and process evaluations and things in the context of India's programs, right? All of you have your state coverage notes, and you've probably seen very similar figures there. One of the things that I really value about where the National Nutrition Mission is right now is that they are also valuing research and evidence, right? I mean, we were able to co-host a major event on research to support Poshan Abhiyan in September, and it comes with this recognition that we have the platforms in India, the ICDS platform and the health platform. But despite years of effort, the coverage of interventions on these platforms varies tremendously. It's not that it's uniformly bad, nor is it that it's uniformly good. It varies by state, it varies by district, within state, but it also varies within each district by intervention, right? So it's not, there are some districts where things are potentially, you know, in the red zone on implementation for many interventions, but more likely than not, you will find a real mix. Doing research that relates to these kinds of processes of how programs are implemented, you know, go back to what's happening with implementing organizations, what's happening with client populations, it can really help to identify challenges and solutions. You can do RCTs within implementation to test solutions. So this is the kind of work that, for example, JPAL has done a lot. You take a big program, you can't necessarily evaluate the big program, but you can do a lot of small but meaningful pieces of research on how to improve, you know, small scale things within it. I wanted Subrat to see that. So this is a ultimate metric of convergence. What we did is we took these 10 essential interventions that are there in Poshan Abhiyan and we combined them all for mother-child pairs. And we found that only 1.5% of children 1 to 5 years old had received all 10 interventions from when their mothers were pregnant to that first year of life, okay? So I tell anyone who works on convergence, this is what you need to worry about. Are all the interventions reaching the right beneficiaries at the right time? These are very researchable questions. These are questions around which you can design impact evaluations, around which you can ask important questions, around which you can design process evaluations. So what do those kinds of research studies look like when you decide that you really want to get into processes and understand why things are working or not working? They can be, as I mentioned in the Alive and Thrive context, we had process evaluations that were nested into impact evaluations, but it doesn't have to be that way. You can do a formative research study, you can do standalone operational assessment to say, you know, I want someone to come in and look at this. So we did, for example, this is how we started looking at the quality of growth monitoring. We were asked by the government of Chhattisgarh to come in and look at their growth monitoring program because they do a once a year Vajan Tyohar, weighing everybody in the state everywhere, and they wanted us to look at the quality of what was happening in that. That is a standalone operational assessment. Now that has surfaced a bunch of issues that maybe we can test in an experimental study, right? To say, does better training improve the quality? Does better equipment improve the quality? Does having a ready reckoner improve the quality of growth monitoring? Those are sort of, you can do an RCT, for example, to look at those kinds of endpoints. But you can also do creative monitoring. I know Divya will show us some examples, maybe of creative use of existing monitoring data for implementation research and to help answer questions. You can do implementation-focused analysis of secondary data, so the kind of coverage maps that I've shown you, that is implementation research. It's shining light on a problem. You may have to do other things to test solutions to that. So you can do a whole bunch of things in implementation research. You know, you can look at a range of things related to implementation, a range of things related to uptake of interventions, range of things related to context, and you can use methods that really speak to those things. So you can do reviews of program manuals, you can observe program quality, like we observe growth monitoring in a few different states now. You can do interviews with people. You can shadow workers. So what we did in the CAS evaluation, and we haven't evaluated that yet, we had researchers actually following Anganwadi workers to do assessments, just to watch what they were doing, and then we'll come back and connect the dots. And then you can do a lot of things also on the household side, to understand why they use program services or not. Why do the rich not use ICDS services? If the rich used ICDS services in villages, more likely than not, the quality would start to grow up. If the rich see the ICDS as a service for poor people, there are less incentives, potentially. I mean, this happens worldwide, to improve the services. A very researchable question is exactly this. Why do the rich not use public services? All right, so I'm going to leave you with, if you're interested, we had a conference in September 24th. Everything is available in public domain on our website. It was really an implementation research conference combining impact evaluations, process evaluations, standalone assessments, looking at these many thematic areas of Poshan Abhiyan. And it's all, publicly available. What we also did was we worked with the large team that coordinated the conference to deliver research-based key messages to the government on what they needed to pay attention to now in terms of rolling Poshan Abhiyan forward. So I just want to leave you now with these key messages. So going back to the idea of impact evaluation, it's important we know about different evaluation designs, what they give and what they don't give. Really important in thinking about impact evaluations to really dig into this issue of selection bias and counterfactual if you want to claim impact. But more importantly than that, think about how results will be used when big impact evaluations are done. Process evaluations, ground them in impact pathways. They really, really help because they give us reality checks. It would have been such a big mistake for us to do an impact evaluation of the impact of ICDS CAS on stunting, for example. It would have been a huge mistake because the temporality just didn't allow it. And then if you did a risk factor mapping of what causes stunting, you would end up realizing that the ICDS CAS only changes a few risk factors potentially, So it would have been a very big mistake for us to do that if we hadn't gone deeply into the theory of change and the timing of that. And then on data and evidence for decisions, these are my takeaways, but I know Divya will share a lot with us later. We hopefully will have a chance to share with you something about the data value chain, but really the emphasis on data for decisions is the recognition of multiple choices and then focusing on use. So let me stop there. I know it was a lot. We can continue to talk over lunch as well. I'm just going to sit down and drink my cold tea while you guys ask questions.
But you'd have to speak in the mic.
Oh, okay, that's fine. Then I'll stand and drink my cold tea. Yeah.
Yeah. Can I? No. Thank you. It was really a wonderful session, Dr. Menon. I mean, in Poshan Abhiyan, every state has a implementation research budget which is nearly around 50 lakhs for a year or something. So this is a program. I mean, I'm really glad that they have included the research component to understand, research questions and stuff like that. So I just want to know, in entire whole spectrum, where does this realist evaluation fits? See, for instance, if I want to understand any intervention impact, to whom it worked, under what condition, and then all those stuffs I want to understand. I've been reading this realist evaluation very recently. So does this fit here in any intervention? Is this scope? And then should I use? And then if I want to use, how can I use this?
That's a great question. Do you want to ask your question too? Yeah?
You want to collect a few questions?
Yeah, I think it would be nice to collect a few questions, but
yeah, I have similar question.
Okay.
I have similar question. Now, when we are answering the question of what work, for whom, under what condition, and why. Now, as you mentioned, RCT has certain limitation in randomizing everything in social situation and unpacking that process also. And now there are, many, methodological innovation. One is, as he mentioned, the realist evaluation, and the another one is, fuzzy set of qualitative comparative analysis where we take, a moderate range of, counterfactual case studies ranging from, 15 to, 80 number of case studies, and come up with essential set of the conditionalities and necessary set of conditionalities, and bringing out a causal recipe, they call a combination of and it ranges from situation to situation. And in your opinion, how robust is that method in unpacking the causal pathways of the what work, how, when, and under what condition is that? That is because this is some kind of work I am also looking forward. So I like to get your opinion.
Is the next question also about those kinds of models, or completely different?
We are actually working on district budget analysis, and while doing our field work and even in secondary literature also, we found that the major problems are human resource shortages, infrastructural bottlenecks, and capacity issues. Now, so given the bigger macroeconomic instability, for example, in 2003, the FRBM Act had been, implemented, and the states were asked to, maintain the fiscal prudence. They were supposed to lower their fiscal deficit and revenue deficit below 3% of GDP. And the major chunk of the state's expenditure actually goes on salaries. So they stopped recruiting new people. So there are this problem. Secondly, the fourth Finance Commission's recommendation after that, during that period, the nature of fund that is going to the states have changed. Now states are getting more untied funds, but along with that, centers' contribution to these programs have also reduced. So the states are now given with two choices. One, they can ask for demand for higher amount from center, so they have to spend more as their matching share has increased, or they can demand less amount from the center and spend the rest of the money on their state-specific programs, which is, they have it can be a strategy for their electoral politics. I'm not getting into that. So that is another thing. Number 3 is the terms of reference of 15th Finance Commission has asked the Commission to see whether the fiscal deficit grants has to be continued or not. So in that case, the states will not be getting the grant they are getting for tide over their deficit situation. So given this bigger macro instability, how do you think the implementation of these programs can be successful? Because we are not working on this human resource shortages, we are not able to address this infrastructural issues and the capacity issues.
Right. Okay, so that's not an evaluation question.
Yeah,
all right, but I'm happy to comment on that to the best of my ability. But let me answer the 2 evaluation questions, and then I'll come to you also. Yeah. So.
Please explain what's the realistic.
Right. So there are, just like everything else, there are philosophies and paradigms in evaluation, in program evaluation as well. The paradigm that I have been trained in and that I work more in, although I think we do quite a bit of tending towards realist when you do a lot of process evaluation and things like that, is more of the quantitative approach to program evaluation that actually also aims to answer the whether and how much questions, right? There are other folks, and there's been a lot of writing on other models of program evaluation, where maybe you don't need to answer the question of how and how much, of whether and how much, but you want to answer the questions more of how and why and for whom. And so those often are situations where people do these kinds of case-based analyses and realist evaluations. I'm not dogmatic about what model to use. I truly believe that the evaluation design has to follow the evaluation question. We cannot just go and do a quantitative evaluation if that's not going to add value to what people do with the information, right? So if, for example, what you do with the information on a more qualitative, realist-based evaluation is to say, okay, I'm going to do that in a way that helps me understand how the poorest of the poor engage with the program, how people of a lower caste engage with the program, what their challenges are, etc. And I'm going to use that information to improve the program. If that's what you want to do, then that is the model of evaluation that you may want to approach. If the question that you ask is, I want to know what impact this program has in quantitative terms on the poor or on equity, you can set up a quantitative evaluation to answer that particular question, but it's going to answer the what and how much rather than the how and why and how do you resolve bottlenecks. I really think that evaluations should use a portfolio of methods. They should, if you're going to invest in an evaluation, you might as well ask more questions than less questions, because actually it's very time and resource intensive to do good evaluations. And, good evaluators will bring multiple methods to the table. Good evaluators will listen to their policy counterparts. If it's a, big sort of policy program evaluation, we should not be doing evaluations just for our research papers. I mean, we really don't believe in that model of doing evaluations. So, your question. You had a question. And then there was one of you in the front. Yeah.
Amazing presentation. Thank you very much. This is so valuable. Are we going to put these videos online?
We don't know yet. We'll put your comments online. I'll take that.
So, I'm like, honestly telling, if only, this presentation and this understanding of the concept of evaluation goes to, let's say, DM of every district, they can understand in, let's say, simpler ways how to, at least take important learnings and implement. That would be so amazing. So I really request the decision makers here to put the, the video online. Now that being said, so this brings me back to the first day question which I had asked about Poshan Abhiyan targets being set at stunting and not wasting. And I had argued that time that stunting, since intergenerational, wouldn't be it appropriate to take wasting as an index to measure the progress. I wanted thoughts upon that.
Okay, very, very good question. So yes, while stunting is, is intergenerational as we put it, it does change. It does change fairly quickly. I mean, the fact that in 10 years you see a 10 percentage point annual decline in India. In some states, you have seen a 15 percentage point. There are some states that are outperforming what one would have expected. So when you look at a population level, you certainly see that the outcomes such as stunting have changed faster and more than outcomes such as wasting, right? So I think that goes against, in a sense, what we think about stunting being difficult to change. I think the intergenerational part of it, etc., is really, comes from the thinking of whether in an individual child you can improve their linear growth as much as you think you can. But there's actually plenty of interventions that also show that the right conditions in place. So, for example, in the Bangladesh study that I talked about, we did a behavior change intervention, right? We didn't find an impact on stunting. In the same time frame, the people who did interventions on individual children, providing both behavior change and food supplements, or behavior change and cash supplements, they found an impact. They found that those children grew more than the children who didn't get those inputs. So, on the other hand, so in other work that we've done actually in Haiti, we found that putting those interventions that create the right conditions for growth in place had impacts both on stunting and on wasting. Ari.
I'd kind of just like to add to that, because I'd like to tie in a little bit the previous presentation from the Poshan person himself and this one, right? Where the target for stunting is a reduction of 2% per year, right?
2 percentage points.
2 percentage points per year, right? Starting immediately. Now, right? That is kind of, that's the pushback is, first of all, give me time to scale up the program, because until the program is operating at scale, nothing can change. And then let's build in, right, what Purnima has been talking about, which is give everybody long enough to actually benefit from the program, right? So a 2 percentage point per year starting 5 years from now, maybe, right? But don't expect this program to have any benefit on stunting for the next couple of years. As we heard, there's no capacity, right? There's no supervision. All those positions are unfilled. The technology's not operating, right? Why would anything work, right? We need to do the implementation research. We need to do the operations research. We need to be able to hire enough high qualified people. We need to get everybody at the consumer level, right? The moms and the pregnant and the not yet pregnant women to be engaged with the program, right? And then we can start to see things. Now, once everything is in place, you can start to see those sorts of changes, as kind of Ray talked about in his talk yesterday, right? If you kind of basically hold a kid's nose and push food down, right, which is what a feeding program is, an efficacy study, you can get about 2 centimeter, 3 centimeter difference in group means between, once that's been in place for 3 years, right? That sort of level will persist over time, but it takes a while to get there. Now, if you're going to use NFHS to evaluate, remember that, the stunting happens in the first 2 years of life, right? So you'd be very careful with which age groups you look at in an FHS and when those children were born as to whether or not it is reasonable to expect that kind of there will be a change, or you will be able to observe a change. All of this needs to come into it, and you need to be going back to kind of take it from a data perspective and a science perspective to say, what is realistic to expect here, right? Because otherwise, programs that we know will kind of, once they've been running for 5 or 10 years, we can see big impacts, but we don't want them shut down in 3 years because kind of nothing's happened, because we would not expect anything to have happened, right? So we really need to be bringing those numbers in.
Okay. Shweta needs to close the session, so let's just continue.